think you're on.
Yes, hi. Good evening, everyone. This is Dr. Khan from Executive Plastic Surgery. I'm here in the waiting area, as most of my patients will know. And so we're talking live from Providence Parkway, Suite 125, my clinic here in Novi, Michigan. So I'm delighted to have a very special guest who I just learned about not too long ago, and she was kind enough and able to share with me her experience. And having said this, I'm going to go ahead and introduce Don Pugh. She is a close friend of one of my patients. One of my patients did call me up and inform me about Dawn, and I said, and when I heard what her goals and ambitions were, I was 100% for it. We have in our tasks and goals and responsibilities to bring about the awareness of breast implant illness. We want to go ahead and let the world know, including the many physicians, that it certainly does exist and that it is a very real entity with real problems, and what we know of is a very real solution. And the solution to this is to remove not only the implant but the capsule in its entirety as one, such that the body has a chance to bounce back from the toxins that are haunting the patient, from the toxicities of the silicone. And ultimately the goal is to free the body of all the capsule, 100% of it, not 90%, plus also any inflamed tissue that might be present, such that the body is free of the toxins and it has a chance to equilibrate and bounce back to normal. Now, having said this, I'm going to go ahead and introduce Dawn. Welcome, thank you very much for coming. You drove quite a distance to come here and meet me in person rather than doing it as Facebook Live or Zoom Live. No, thank you very much. And please go ahead and share with us what is your mission, what is your goal, and how you can unite the many women who are hurting and suffering.
Yes, and thank you so much for having me here, and blessed to be able to come and have this experience and share this news. Right now, what we're working on is legislative paperwork, getting a bill ready, and that bill is going to be Representative Julie Calley is going to be the one that supports it and brings it to the floor. It should be to the floor in about 2 months, and what it's going to do is require that specific physicians for plastic surgery, what have you, that they actually give true informed consent.
So this is for the state of Michigan only?
Correct.
Right. Now tell us about the success that we have had in Arizona.
Now in Arizona, we just passed a bill, and with this bill, you will get true informed consent. You will actually go through a checklist with the patient. And in this checklist, it goes over many of the things that typically are not discussed when you get implants placed.
So this is what you're mentioning is a mandate for the plastic surgeons to discuss very openly and directly, and this is a bill passed by the Arizona legislature where the surgeon has to discuss very actively what are the problems potentially with the implants. Now, what exactly is it that they will be discussing and acknowledging as behind as far as what is the informed consent?
Now, one, they must give the manufacturer information and warnings to the patient.
Okay.
And that includes the black box warning.
What is the black box warning?
Now, 2019, the FDA declared implants to not be safe, and some implants were recalled, and they have an actual list, the FDA, symptoms for breast implant illness.
Sure, and again, these are the three major highlights, and again, if I may clarify, the first and foremost, that the implants are not meant to be in the body forever, that they have a limited time span. So for a surgeon to say that they are going to be in the body for the rest of one's life, so for example, a 26-year-old that wants to get implants and she's going to live into her 80s, that's absolutely not true. On average, from my experience and from what we know, the average lifespan is 7 to 10 years. They mentioned 10 to 15, but again, you could have as short as 2 years. I've had a patient remove implants that she had inserted in 2019. So this is, again, depending on how short-lived it is. So the second thing that they mention is that the implants are replete with problems, what we know as breast implant illness. There are autoimmune issues, rheumatological, joint pains, amongst many others. that the manufacturers have put forth and acknowledged that, yes, in their studies and the many studies, and this is where the state of Arizona has basically, and what you mentioned very clearly, is the state of Arizona is bringing to the attention of those prospective patients who are going to get implants. Be careful what you're signing up for. Just like it says on a cigarette box that it causes heart attacks. So now sometimes, it does remind, maybe after some time, it will serve as a true warning and informed consent that they're not meant to be forever and that they are associated with problems. And certainly what we heard from France and ultimately the US, where the textured implants were absolutely banned and they are not allowed to be put in the body. And so they are associated certainly with lymphoma, and these are primarily the textured implants. So the black label warning, the black box warning that you mentioned is very much real and very much true. And one thing that I might highlighted by the FDA, which is a big deal, because this is something that is the administrative body that's responsible for ensuring delivery and continued quality of life of not only the many different devices, but following up with the patients, making sure that it continues to monitor and deliver the best of healthcare to the American people.
And that is another aspect of it, is that they would be required to tell patients where to report their adverse reactions or symptoms that they're having. As a whole, most of the women I've talked to haven't really received any of that information until it's after the fact that they've had a problem with their implants. And I think that's really important, that they have a source to go to report these things, rather than lingering. Do I go in and say something? Yes, you do need to say something.
If you don't report it, no one's going to know. And that is a very important point that you mentioned, and what the FDA is basically putting forth, so that they can continue to keep count on what are the many adverse effects.
Yes, and with the bill that we're trying to put through with Representative Julie Kelly, it basically shadows what's going on with the Arizona bill, and we'll see if we need to do any amendments. But it sounds like it's something that's going to happen, and I know if more people that know what this can cause, there's going to be less people taking this risk.
Sure, and absolutely, this is part of an informed consent. This is very similar to someone wants to get a artificial hip, like for example, or a knee replacement. There are, as you will see, many recalls on pacemakers, for example. The battery is running low, things of that sort. We want to be able to, again, bring to the attention that, number one, breast implant illness is real. Now, I have a following, and I said there is no other better source to have you come direct and talk, because you are one of the fundamental pillars that is enabling, making sure your words will bring about a lot of change. This meeting will bring about a lot of change, and hopefully the reporting of the negative adverse effects that the implants cause. So I warn each and every one of my patients, if they can, and the many, many states, this tomorrow morning at 8 o'clock, I have a call to Sweden. I did take care of a lady from Panama, from Japan, and the point I'm trying to make is we have a role and the leadership to be responsible for alerting patients, which is very humbly letting the patients know that this is what is known definitively, and this is what to look out for. So in case those women who, after educating themselves and believing that the implants are better for them, they need to be aware of what is expected. The implants are not meant to be there forever. They're responsible for the many ailments that led to the ultimate ban in 1992. And we just want everyone to be aware, whoever is listening, especially those patients who are interested, or the significant others, or the young ladies who are interested in getting implants, that do your homework, do your research, so that, God forbid, if you do get those symptoms, you are better aware as to what is coming, and so that you're not going to be in disguise, or you're not going to be told that this is part of old aging or hitting menopause, or it may be associated with the underlying Hashimoto's, being tiredness, or the fact that you may have 5 kids and that's basically wearing you down. Now, another question I get asked as a board-certified plastic surgeon, what % of the patients are going to get breast implant illness? And my answer is 100%. And the reason behind that is, we answered the question earlier that the implants are not meant to be there forever. They're replete with infections, contracture, basically pain. You have asymmetry amongst the reasons, such as you have the lifespan of the implant itself and the reactivity. And as we know from the Facebook Live done several months back with Dr. Mowers, who clearly stated, when I asked him, would you want anyone to get implants? And he did mention, well, every time I look at a capsule, I see there is inflammation, and I would not want anything inside anyone's body that would cause inflammation. So his short answer, to echo his thoughts and words, that was not a sound idea. Now, please tell me, how long, if you happen to know, what did it take for Arizona to pass that law?
Well, it was moving along quite quickly. Then COVID came along, so it was stalled. So I'm not really sure exactly the time that they started that bill, but I don't know that it was like over a year. I don't think it took that long. And it did pass unanimously.
No, that's very nice, yes.
So
now the other thing that I learned from you, when I made that phone call on Saturday morning, you informed me that California is in the process of passing that bill. So that is huge. The great golden state of California is about to, and hopefully time will tell and be witness to the fact that they're going to follow suit, and they're going to follow what Arizona has already done. So this is very exciting news, that the legislative bodies are responding and reacting to the patients and not necessarily the doctors, and helping the patients out. Again, this is a very basic step, but at least the first step into raising awareness of what is breast implant illness.
And it's a call to action. If you're in Michigan, if you're in another state, Michigan folks, if you can go to Find My Representative on michigan.gov, you can put in exactly where you live, find your representative, give them a call, send an email, write a letter, and tell them that there's going to be a bill on BII and informed consent, and you expect their full support of this bill when it happens. And share your stories, because it's your life experiences, and they won't know this unless you share it. So get out there and make that contact. Like I said, Representative Julie Calley is the one that will be bringing the bill to the floor, and if all goes well, you know, we're going to have success at getting this passed.
Sure, but this is huge. What you mentioned is essentially what is driving the U.S. It's we the people, and so what you're mentioning is that the ladies, each one of you, and including the males, the sons, the neighbors of these very nice patients who have been hurt by what is breast implant illness, don't underestimate the power of the pen, the power of your email or the text that you will send one another. I want each one of you to talk. This is the time, if you will, to vote. This is where you have an obligation to help, and all what we're doing is just raising awareness. We're not asking for anything else, but humbly telling everyone who is going to get the implants that this is what is expected. This is the black box warning, and the implants are not as safe as they are advertised to be in the many journals and in the many news media outlets. Now, speaking of which, the news media, as we have seen, newspapers, the Cosmopolitan magazine, Fortune 500, they all have done reports on what is breast implant illness. I was on hold with an insurance company once, not too long ago, and the next thing you know, I flip over one of the magazines, and there is breast implant illness, and I was totally surprised where now it has made it to the regular journals, magazines. And this is exactly what we want. We want to raise awareness in a very gentle, polite, but sophisticated way. We want to be able to write about it. If you will see, this was an article in Arkansas, you know, that one of my patients mentioned. You can only imagine how the masses read it, and it will get passed on from one patient to another, from one story to another. I will tell you how many countless patients have I met who just read one or two lines and they were made aware of BII just like a month ago for the first time, for something that was coined not too long ago. And the point here is we have a momentum and we have an obligation just to raise awareness.
And we want to do it with physicians. We want to do it with the lawmakers. We want to have the plastic surgeon patients, and we all want to work on this together. We want to make it happen. And I can't see too many plastic surgeons that wouldn't want a patient to know, oh, if you have autoimmune disease, this could affect your quality of life.
Sure.
That is going to be in this bill. You will know these things, and it just to have that information out there is huge. And we want it to not be against us against them sort of thing. It's not that way. I know plastic surgeons want the best for their patients as well.
Sure. No, I will tell you, the ASPS is a very reputable organization. We are a group of professionals that are truly sympathetic as part of the cloth and the underlying conditions of maintaining a status within the society. It's all about professionalism. It's all about the patient being first, the patient being always the center of attention, and everything revolving around the patient. And this is very important and integral, where we're providing the patients a service, and the patients are making an informed consent, truly understanding that if they have an adverse effect, that they're mentioning and bringing it up. And this is definitely a start. What we want is, we want to acknowledge what is breast implant illness, what we know that the FDA has, but we want the masses. If you were to talk to an average dermatologist, a family medicine doctor, a dermatologist, infectious disease doctor, an allergy immunologist, all of them will undeniably say BII is a myth. It's a thing of the past. It has been corrected. They were reintroduced as safe, and this is far from the truth. We all know, I get texts and messages on the Facebook, saline implants are considered to be safe, and I will say absolutely 110% not. Saline implants, yes, a good part of it is saline, which is relatively benign. It's the sodium and the chloride salt, which basically is part of the serum, but the shell is the silicone, and they are as bad, if not worse, because they give you the illusion they're safe. And the bottom line here is, we have the same reactivity, the breast implant illness, in those patients who have saline implants, and the same reactivity that the silicone patients have. And the point I'm trying to make here is, it's just like smoking a cigarette with a large filter versus a cigar. Two different tobacco intakes, but both of them cause cancer, and the same scenario, both of them are replete with problems. And to answer the lady's question, removing saline implants is as hard as removing silicone implants because of the capsule that's encased around them. They certainly do get the same contracture as do the silicone. The only one good thing about saline implants as a plastic surgeon who explants is, if it's ruptured, it's essentially, on physical exam, a relatively flat chest, versus silicone. It could very well be ruptured, but still very much contained, because it is so thick and viscous, it doesn't have a chance to leak out, but only slowly. Again, to answer one of the questions that I got earlier in the week. Now, if I do recall and remember from what you just mentioned, you want us to write. So what is the website you want the local, let's say for example, someone in the state of Idaho, or someone in Florida, for example, or Texas, how and what should they do?
They can also go to their state's website and put in who is my representative. You can go ahead and
so just go on Google and type in who is my representative.
Yeah, and it should say, Michigan. It should say your state usually.
Sure.
Yeah, you can just click on that. It will ask for your zip code, and that's about it. And then you can get their information. You'll get phone numbers. You'll get assistant phone numbers. You'll get websites. And what I did is, I had actually wrote by email my representative 2 years ago that I was so concerned with BII, and that I was seeing what was going on, and I wanted her to jump on board. I thought, somebody needs to get on top of this, so people at least know what to expect when they're making this important decision with their body. And
what do you want the patients and their significant others, friends, and family to write?
That your experience, your wife's experience, your daughter's experience, and why it has affected their lives in a bad way. Yes, because everybody kind of has a different story. A lot of women do have different symptoms. There's a lot of us that have all the same symptoms too, whether you've had chemo, whether you've not. And just tell them that, it made a huge difference in your life. I know it changed my quality of life immensely. And tell them how heartfelt it is, and that when this bill does come up, to please fully support it. If you're in another state, tell them how much it means to you, and that you'd love to see something get started, that you would love to get a bill started, or if there's somebody there in the legislation that wants to get something going, that you'd like to start. We'd be glad to share our paperwork and get this started everywhere. Nobody should be suffering with these breast implants, and many women that are suffering, blame it on, like you said, old age, being tuckered out with the kids, or chemotherapy. And the thing is when I had mine out, mine was more for a physical thing. I had spasms, I had ribs out constantly, my back was out, my shoulders were out of alignment, and my rheumatologist and osteopath both said, you need to get these out of there. So I get them out, and the first day, this horrible chemical aroma that came from my body since the time I had them on, I describe it as a chemical, money, dirty smell. Mm-hmm. It was gone. The night of my surgery, it was gone. I didn't have night sweats, and I haven't since. That surgery, I was having them every night, hot flashes all day, and that has went away. I had uncontrollable blood pressure just out of nowhere, 210 over 110.
Wow. For
years. I'm very lucky to be here, that I didn't have a stroke. And guess what went away? Like 6 months later, they were saying, man, your blood pressure is so low. I was on 5 different blood pressure medications. Wow. Now I'm on 1.
Wow. We had another lady within the state of Michigan. She was at a major hospital here. She spent almost 6 weeks in the ICU. They had every single doctor, from the pulmonologist, cardiologist. She was on 5 blood pressure medications, and believe it or not, unfortunately, this young lady in her mid-30s actually stroked out. So she had right side hemiplegia, and her dad actually went into the doctor's office and said, here, I just went home, and this is the BI paperwork, and I looked this up, and I want you to read it, and no one believed him, unfortunately. And this is exactly what you just mentioned. And again, if I may highlight, I had a colleague of mine, a cardiologist, who was on last summer. He was a Facebook Live, and he did mention, he sent me a patient. He said, I want you to remove her implants because they are the ones who are causing the vasculitis, the toxicity, and hence the blood pressure. I'm going to go ahead and get up. So these are sensor lights. So they're going to go ahead and come back on. Alright, so basically here we have, the different doctors who are now recognizing. I saw actually a patient. She is a representative for one of the implants for epilepsy patients. My last patient that I saw, she came from Ohio. And so she said that she's going to take all the information, her lab workup, her symptoms, her improvement. She's 3 weeks out, and she's going to tell her physician how she has improved. Because this is the homework that we all have. Now, I say this to each and every single patient. If I were to go right across, right behind, we have the Providence Hospital, major hospital system of the state of Michigan, and all the 1,200, 1,500 physicians that are affiliated, that this is BII, you remove the implants and the vision improves, or the joint pain improves, they're going to say, well, this is a placebo effect, this is a myth, this is everything but the implants. And unfortunately, we are at this stage where the vast majority of the doctors, unfortunately, and so this is where I say to you, who's the local representative talking and writing so that they can bring about the same legislative change within your respective state capital, number one. Number two, talking to the local newspaper, writing an article and an editorial. Believe it or not, that pen of yours you think is not going to make that move. It is the strongest weapon you have. And I use the word weapon in the sense that it is really going to help make the cause, and it's going to pass the information along in a very gentle and in a very smooth way so that we are going to bring about change for the better. And it is exactly these words, the ladies and the masses, the lady from California, the lady from Washington State, the lady from Connecticut, Florida, that they're talking, they're basically sharing their experiences, their improvements, having explanted, and the next thing you know, the ladies are driving this movement which is causing a change for the better. And I say this to the ladies, unfortunately, given the situation and how things work, you have four groups that are involved. Number one, the manufacturers themselves. They're certainly in there, ad after ad, saying this is safe and effective. These are the exact same words that are used. They will not bring about the change. Number two, the plastic surgeons, certainly they're starting to learn, as you will see. Dr. Frank presented at the last society meeting, and she's bringing about the fourth, the leaders of the American Society of Plastic Surgeons have brought forth groups, basically allocated money to do more research and to understand the adverse effects, but that change is still relatively slow. Now you have the the patients themselves who basically are talking about and bringing about the change, and this is where the patients are writing about it, and this is certainly the change that's going to come for the better, and this is what we're looking at that will certainly highlight to the rest of the world what is the breast implant illness and what we need to do. And again, the proof is there. The ladies talking and sharing the same common denominator, which is the implants, and we know we don't have lab workup, we don't have imaging study that shows you have breast implant illness, but all what we have going for us convincingly, we have that questionnaire where you have all the organ systems affected, from the hair follicles all the way down to the toenails and everything in between, from the nervous system, the integumentary, the skin, the GI, the cardiovascular, the joint, the ENT hearing. Just today, after I got done with clinic, I talked to a lady who 6 days ago, had the explant done. She told me she has had vertigo for 2 years. She could not bend down. She told me she has not had any vertigo in the last 6 days. Now, I have not, this patient is very organized. She's from the state of Illinois. I promised her one thing. She's very orthodox, very systematic. She's planned out written books for before, during the surgery, and after. Now, I said to her, I'm going to invite you as a Facebook guest next time so that she can share her experience, what led her to come and get explanted convincingly, and what is now, and what is what I will say the essential surgery, where the explant is absolutely considered essential. During COVID times, during the lockdown, I had patients that came. Another very sick patient who had severe pulmonary hypertension, and this is where the cardiologist called me and said, you need to take the implants out. I did her surgery 9 a.m. in the morning on Monday at Providence Park Hospital, prime time, where my other colleagues, patients of theirs who had rotator cuff or meniscus or hip, they were not allowed to, and I was able to get that time. And everyone knew this is essential surgery, this is required per state guidelines at the time, where elective surgeries were banned, and I was able to go and get these surgeries approved without any problem. And the point here is the medical community is recognizing, the Society of Plastic Surgeons, the American Society of Plastic Surgery is recognizing. But what we need to do is we need to let and make the awareness, hence your presence here, alerting the prospective patients. Watch out, look what you're signing up for, because it is not as benign as it appears to be. And this is where prevention is key.
Yes, definitely. And you know, so many people suffer from autoimmune diseases, and that is, I feel like that's probably one of the biggest things, that's a red flag. If you have autoimmune diseases, definitely don't get breast implants. And when I went in there, like I said, it was more of a physical thing. You know, I had breast implant illness, I'd heard about it, but everything was blamed on chemotherapy for me. And the fact that so many things got better immediately, it was unbelievable. You know, all these, it was kind of like they were all bonuses. I didn't think all those things were going away. I thought I was going to have them forever, quite honestly.
Right.
And, you know, I was coughing up enormous amounts of mucus and stuff every day. And just that kind of thing stopped instantly. I had lesions all through my scalp. That was gone.
Wow.
There's so many endless things that really affect your quality of life overall. And if these women get these checklists, just the checklist alone, that whether it's electronically that they go over or physically, oh, red flag, you know what? Wait a minute.
Right.
Maybe I need to look into this a little more.
Absolutely, absolutely. So, you mentioned things that make me angry, and I'm going to highlight this. I saw a patient 4 or 5 months ago, and I operated on her, 28-year-old lady with cystic fibrosis. This is a lady with lung issues. As we all know, cystic fibrosis is a very serious lethal disease where you have so many lung infections. And she was offered breast implants. Unfortunately, as you know, when the implants sit, they restrict the movement of the lung up and out. They cause and predispose the patients to what would be opportunistic infections. Had she not had the implant, she would normally be able to cough them out. And certainly the inflammation. And she unfortunately was offered breast implants, which is absolutely unforgivable, if I may use that term. My neighbor, when I moved in, I just knocked on her door and I said, I just want to introduce myself. And the husband reached out to me. I see you are wearing scrubs because I'd just come home from work. And I said, oh, I'm a plastic surgeon. And the next thing you know, the husband's so excited. Oh, my wife, she's going to get implants. She just had breast cancer and she's going to get reconstruction. And then I stand there and I ask myself, I have two choices: to be politically correct and say, good luck, I wish you the very best. Or I said, I'm going to speak my mind and hopefully I won't get into trouble. And I've never gotten into trouble by speaking my mind. And I said, what? And the next thing you know, the next question I asked, she has a kidney transplant. So she's on immunosuppressive drugs, on prednisone, tacrolimus, which is essentially suppresses the immune system so the cadaveric kidney does not get rejected by the body. And I said, you're the last person who needs an implant. And I told her that is going to be the biggest sin that you're going to do, as an informed consent. Now, she did not talk to me well after that, and unfortunately, they did proceed with the surgery, and they then moved to Wyoming afterwards. But the point being here is, you cannot be offering implants to patients on basically transplant medications with kidney issues, because they're set up, they're like bubble boys, bubble patients where they have to be restricted and they cannot have unnecessary exposure to what would be potentially predisposing infections, especially with implants. And again, wound breakdowns amongst many other problems. So again, everything has a risk versus benefit, and we have to basically take into consideration what you very clearly mentioned, the autoimmune issues. So now what we need to do is, and again, going back to and highlighting, yes, we may not have the lab workup, we may not have the imaging study, but clearly that questionnaire where you highlight all the problems with fatigue, very common problem, brain fog, GI issues, what you said, the throat clearing, ringing in the ears, metallic taste, vision problems, cardiovascular issues, unexplained high blood pressure, joint pain, all reproductive issues amongst premature menopause, amongst the many other things, certainly highlighting what is breast implant illness. That is the certainty. Today in my clinic, on Wednesday afternoon, I asked the patient, what % chance do you think out of 100%? And I kind of put him on the spot, because this is them before they even come and see me. This is the patient relating to the other patient and saying, oh, okay, I can relate myself to the other patient. And this is where I asked them, what % chance do you think you're 37, 52, 49? What % chance do you think you have BII? The lady said, not 100%, 200%, because what else would it be? And I say, if you take that questionnaire and you give to your friends from high school, all your high school friends, be it male or female, will check only like 2 or 3, but not half or 30 or 40 of those symptoms. And this is what you see is the hallmark features of breast implant illness.
It truly is. You see lists of BII symptoms, and some people would probably think, oh, can't have all those symptoms. I have, and those big lists, I have a list added on to that list.
Wow.
Women are really experiencing so many issues with breast implants, and to me, it's very telling when you don't have a rupture, you don't have a leak. My implants were totally intact when they were removed. Yet I smell like chemicals, and if I try to do a sauna, if I was out in the desert, very hot areas, it would increase that hypertension. And the smell of the chemicals was just horrible. People would actually think I had chemicals or something spilled.
Right. So this is a very important point you mentioned. You've highlighted all the major aspects of what is BII that you yourself were exhibiting, from the vasculitis, being on 5 blood pressure medications. This is significant information. So I myself, anecdotally, having talked to so many ladies, very common point, the foul body odor. This is where you have your body's kind of in overdrive, and exactly what you mentioned. How soon after did you improve after you had your surgery?
Well, like I said, some of the things improved the night of the hospital. I didn't get any more hot flashes. I had them 24 hours a day. Wow. I had to change my whole wardrobe. I had to wear spaghetti strap shirts and skirts because I could not stand having clothes on. It was so hot. And the night sweats went away that night. The blood pressure, that was something that was gradual, but it's held steady the whole time. I had shingles. I've had shingles 12 times. Wow. Since I've had expanders and implants put in, which is ridiculous. And shingles is not a fun thing to go through.
That's super painful.
It really is. There's a lot of nerve pain and numbness that's similar to what you might get after chemo, but these women, they haven't all had chemo. Right. And one factor is the breast implants. So.
Sure. Now, one thing I want to mention is, those patients who are interested in getting the explant, and again, after having done your homework, some patients, believe it or not, I saw this one lady from overseas, she had talked to, without any exaggeration, 15 different explant surgeons. And you know what, she'd done her homework, and I said, write up, take notes, listen to the other ladies. Your best resource is the next patient. So we have a priceless experience from what you were mentioning, because you know what, so many ladies, I can assure you, are going to relate to what you just mentioned. One thing that I want to highlight is the legal bind that you have with your plastic surgeon. Your plastic surgeon should be knowledgeable, experienced, and seasoned so that they can say with certainty that 100% capsulectomy is going to be performed, preferably in the en bloc fashion or 100% total capsulectomy. And that 0% of the capsule must remain behind. Believe it or not, this was my second week into January. Almost 13 days after, I got a phone call from a lady from Chicago. She had her explant done on the 6th of January, and she called me the following week saying, my surgeon promised me would remove the implants, and when he went in, he found that the capsule was tissue paper thin, like a wet tissue paper. He removed the implant, tried to remove the capsule, but my capsules are very much left behind. And I said, this is unfortunately, and looking at the time of the surgery and looking at the surgeon now, congratulations to the surgeon for being very professional and upfront for saying that he left the capsule behind. But the bottom line is, patients have asked me, do you get the capsule out? And I say 100% of the time, and I say I don't leave any capsule behind. And it is important for you as a patient to have that legal bind with your surgeon where you have that absolute commitment from your surgeon that 100% of the capsule is going to be removed. There's going to be no residual capsule left behind, 0% remaining behind. And you want to ask your surgeon, how many times have you done the surgery where the capsule has unfortunately had to be left behind or had to be cauterized? And I use the word, it cannot be burned off of the chest. It has to be physically be removed. And I like the example that I used on the last Facebook that one of my patients mentioned. If you have a barbecue and you burn some food on the grill and you remove the food that's still in that burnt aspect, that black charcoal material, toxins present. And what the body is going to do, remove the debris, and eventually you're going to have that residual capsule left behind. And I want you to look at all those pathology reports where you see a silica, residual capsule, giant cell reaction, foreign body reaction. We don't want to leave any capsule behind. So you have that legal bind from your surgeon to state very clearly that no capsule will be left behind, because this is where your bounce back, good health, recovery, freedom from all of these BI symptom lies. Otherwise, you might improve 30%, 50%, 70%, and not completely, and that's the desired goal of the surgery. Now, the other thing I want to highlight is, those 5 things that one must always look at, which in my mind, as a board-certified plastic surgeon, you can state with good certainty that your surgeon's going to do the right job. And I humbly state this is why I state that this is the criteria, the Khan criteria, what confirms that your surgeon did a good job. And I'll explain briefly. Your surgeon should take on average 4 hours. Now, if your surgeon spent an hour, you cannot do the surgery in an hour. That is virtually impossible for something that on average takes me 4 hours, and I book my patients for 4 hours, and I would say 70% of my time I run into 4.5, 5, sometimes 6 hours, depending on the length of the case. So if a surgery is done in 1 hour, it cannot virtually be done. How about one patient asked, how about a lift and an end block? And I will say that in itself, if you were to do just a lift on someone, you're probably looking at 3 hours of surgery, because it's a lot of dissection around the nipple areola all the way down, which is the lollipop and the anchor incision. So the key, the timing is very important. And again, for me, I can only do 2 or 3 of these in a day. I've never done 4, and I'll never attempt to do 4. Number 2, the length of the incision. If your implant is this wide, let's say it's a 350 cc's implant, on average, a nice, generous 7, 8, 9, 10 centimeter incision has to be made in order to remove the implant completely, safely, without hurting the capsule or hurting the implant, especially if it may be ruptured. So if you have your surgeon that has done a 2 or 3 centimeter and has removed, like say, a 450 cc implant, that is virtually impossible unless the implant was ruptured, and which should absolutely not happen. A saline implant, that is an absolute no. So you want to make sure that the length of the incision is essentially the diameter of the implant. Number 3, you want to go ahead and get the implants back. You will be surprised. Just today I saw a lady, she was told you are going to get saline implants, and guess what? She had silicone implants inserted in her. Another lady from a major reputable hospital, she was told she was going to get saline implants, and guess what? She had silicone implants. I have removed implants where on one side it was Allergan, on the other side it was Mentor. I have removed implants at the hospital where one was silicone and the other one was saline. I removed one which was above the muscle, the other one was below the muscle. And again, and this is, the list goes on and on and on. And I'll tell you, another lady that came from Washington State, her lot number did not match the lot number on the card. Another lady, the size was different compared to what was coded to her. So this is important. So you want to go ahead and get your implant back. So that's another third thing, because I will tell you, even at the hospital, they said, well, the operating room committee has decided that we are not going to. I called the head pathologist up and I said, I'm coming in at 10:30 at night and I am telling you I'm going to go ahead and take this. The pathologist said, well, we look at the implants anyway, and having gotten consent, and I know all the pathologists, they know what do they do with the implants. They physically store them on a shelf. They grossly look at them. They don't look at the implants under the scope. So I was able to talk, and he was able to talk to the committee, and we were able to get the implants because the patient has to see. Another patient that I did just recently from Brazil, she refused to take the implants home. She just thought it was like, I don't want to take something to my kids or someone touches it. And I said, well, guess what? It was inside your body. So today I sent it back to her, and she was 6 days post-op. And I wanted her to feel it because she herself did not want to. And I tried 3 times. I did not want to push her on the day of the surgery. So we have a consent where we tell the patients you must. And if they only absolutely remove, I tell them bring it with you on the day off or before you leave, so that at the airport it's not going to be an issue if you don't have checked-in luggage, meaning if you're going to go on a plane. So that's the third thing. Number 4, you want to make sure that your plastic surgeon has a reputation of doing surgery. Nowadays, look, I walk into the hallway in the operating room, I give a Facebook Live. I myself have an internet reputation, if you will, on social media, where for someone as board certified who has never put in implants, what I do, what's interesting, I did everything from all aspects of plastic surgery, from skin cancer to leg reconstruction, artificial skin, burns, I'm trained in burns, I did all aspects of hand, which I truly enjoy. But now my practice is essentially, explant surgery. And the point here is, this has become my niche, and I'm giving a lot of lectures, editorials. Just today, we had another group that's going to come by, and we're going to I'm going to have very defined patient pictures and videos to show how I do my dissection, how I reconstruct, such that other surgeons can learn why I don't place drains. And this is what I'm going to talk about shortly. So the fourth thing is the reputation of the surgeon. If your surgeon is finishing the surgery in an hour and a half, absolutely that's a big red flag, because that's how long it takes to make a small nick, rupture the implant, remove the implant, and suture close. The time it would take to suture close, do the both sides, and get out of the operating room. Last but not least, number 5, you want to get pictures of the implant capsule on the table being cut, make sure, and also most importantly, the picture of the chest wall showing that your chest is void minus the capsule, and that the entire dissection was done and there is no residual capsule, and which is what I make a point. So 5 things that I would say are technically foolproof. Now, no matter how hard I try, I cannot do the surgery in 2 hours. Otherwise, I would love to be gone by 4 o'clock, 3 o'clock. And normally, as you will ask the many ladies, I've started my surgery, my third case at 5:30, 6:30, being here till 10. And so this is very important. Now, the other thing that other patients have done, and again, to use this about my practice, there are many things that I do that are done differently compared to the many other plastic surgeons. So this is what now the patients come in and say, the Khan procedure, how my surgery is different and what I do. So number 1, almost 99% of my patients, especially with saline implants, they do not have drains. So this is a firm fact. Last year in 2020, and I operated quite a lot, I placed drains in only 3 patients. Number 2, I do not preferably do a lift on a surgery day where I spend 4 hours or so dissecting and ensuring that the patient has 100% removal. There is less damage to the neighboring tissue muscle. There is no capsule left behind. That there is no inflamed tissue left behind, and the surgery is done in this fine avascular bloodless plane. You will see from the videos that the pain medications are reduced. And so I don't do what would be the lifts. Now, there are patients where I've marked, because again, a lift is relatively very easy. A mastopexy is the right term, which is excess skin rearrangement. I always say, if someone has a grade 4 contraction, this is one of the patients that came today, I don't want to do a tissue rearrangement, the dissection around the nipple areola, on a time where I would say with confidence 80% of my patients do not need a mastopexy. Number 3, 100% of my patients get the capsule sent to pathology so they can look at the capsule and make sure there's no lymphoma, no badness, and so we can find out what was the reason for the badness, that inflammation, the chronic inflammation, the giant cell reaction, the metaplasia that we all know of from the many patients who have seen the pathology reports. 100% of the time, I take cultures from the right chest and also the left chest to make sure we're not missing mold or bacterial infection, things of that sort. Number 5, 100% of the time, I give the implants back to the patients. This is, again, very important, again, what I alluded to earlier. Number 6, 100% of the time, I have the patients who have my cell phone, because if there is an issue, a lady had a problem with her, maybe a hair that got in the eye or irritation post-explant, that they can get direct access to me. For example, they may have yeast infection, I may have to write the diflucan. So again, the point being here is, this is a very involved process, and I want to make sure my patients bounce back in the manner that they do. And I have, kind of a moment-to-moment feedback from the patients so that I can offer the best for them, for something that I myself truly believed when I was a medical student, and that I myself have seen within my career what would be a surgeon's and basically an emergence of breast implant illness and the number of explantations.
Well, it speaks a lot of value for just the fact that your specialty is explant, that there's a big need for these women to get these out of their body.
Right. No, and I will say this, I can only do so many of these a year, 300, 350, max 400 pushing it. Now I just open up another operative date. I can only do so many of this, and it's not about quick, it's all about being smart. Every patient is, lack of a better word, a puzzle, in a sense that they come in with their unique set of problems. Like one patient today had lupus. She needs to be started on hydroxychloroquine. She's gonna maybe have some reaction to that medication. Her doc is gonna start her, has already started her on prednisone. Another lady that I'm doing, she has an ejection fraction of 48%. She's a nurse out of Wisconsin. Again, monitored and cleared by the cardiologist. I have another patient who had clots in her legs, and so she is on Xarelto blood thinner. That's not easy surgery, and so I have to be able to navigate her intra-op and post-op without having her getting clots or an embolus, pulmonary embolus. So there are patients that have had diabetes for 40 years, or another patient with Crohn's disease who's on an immunomodulator. I'm going to offer her the same surgery I offer the healthy 26-year-old without diabetes or without other issues who have truly the BLI symptoms. Another lady asked, oh, I have this throat clearing. My neck lymph nodes have lit up. I've already seen the ENT surgeon, so I said, what was the outcome? They did the scope, they looked around, they did the CT scan, they found nothing, and they said, well, it's just likely reflux that we're not seeing. She had the EGD done. Lo and behold, it turns out that she has resolution of what are these sinus/throat clearing irritation. It's all tied up: vertigo, the metallic taste, all of these symptoms, the loss of taste. The most important point here is what you mentioned today. If passed by the state of Michigan, which is only a matter of time, hopefully, just like Arizona and hopefully California soon, what I want through your words and your momentum that you have brought forth with us, that each and every lady from each and every state going to their website, who is my representative, and writing that letter, their significant others, what you mentioned, this is the change that will change the world.
Yes, and write another letter, do it multiple times if you need to. I think until they hear your actual story and their mouth hits the floor, because that's usually what happens when they hear of all these health problems, I think that's what they can really relate to, and that's what turns on that light. It's, we need to get this done.
Absolutely.
Know better, do better.
I will tell you, I have someone that I know who is now working with me in the clinic. She heard of BII multiple times, but only when did she come inside the clinic and hear the patients, only then did it register the seriousness of it. Otherwise, everyone kept and everyone keeps on throwing it off. And the point here is keep writing, is don't underestimate the power of your words, because it is going to bring about that change. We have this momentum. We just want to bring awareness, and hopefully every state will pass this legislation and everyone will be talking about it very soon.
Yes, and the more that we can get this moving along, hey, let's get some codes for breast implant illness so we can bill things the way that they're supposed to be and recognize it as a true illness.
Right. Just like, there is the momentum to treat COVID. Similarly, there has to be a momentum to recognize the seriousness and to have recognition. We already have the recognition from the FDA. We already have Allergan being told by the FDA to reach the 52,000 patients who have textured implants and what they failed to do, unfortunately. We have the governing agencies who are responsible to answer to you, to the many patients, so that ultimately an ICD-10 code is passed, and which is basically every disease. So someone has basically vertigo, that has an ICD-10 code. So when the doctors bill, that code has a pertaining reimbursement CPT code affiliation to it. Once that is done, that is the next step for the insurance companies to say, well, you know what, now we have to start recognizing and paying for what would be these relatively costly and expensive surgeries. Now, one thing I want to also highlight, taking this, if your surgeon says, well, I'm going to take your insurance and process your surgery through the insurance, this is something that I will tell you with absolute confidence will not yield, the surgery payback, i.e. the professional financial reimbursement from the insurance companies is anywhere from $500, $700, $1,200. And we all know this. You can go to Medicare, you can see the reimbursement rates. Sometimes they say, well, removing the capsule is not required. This is not the standard of care. It can only be removed when the patient has lymphoma. And then they say, well, cosmetic in, cosmetic out, breast cancer in, then we will pay and cover. The point here is we want them to recognize that the capsule must also be removed, because we have so many patients now by the other reputable surgeons who have done the surgeries where they had the explant, the capsules were left behind deliberately by that explant surgeon. And when they got their residual capsules removed, then we saw that the patient bounced back from those symptoms. And this is patient after patient after patient. Just last week I heard another patient who had a rupture of the right side of the breast saline implant. She didn't have money. The plastic surgeon deliberately put a needle in and aspirated the fluid so that now you have a relatively symmetric chest, which is absolutely wrong and not the right thing to do.
I just recently, in a local breast implant illness group, Gail had said she went in for a consultation somewhere, and the doctor told her that he was going to go ahead and get that out of there first before he took the implant out. And red flag, could you imagine? And if it's saline, you have the chance of the mold, different bacterias and stuff, and if it's silicone, obviously, people are finding this in their lymph nodes, all through their body. So, red flag. If you have that kind of consultation, you need to find a different doctor.
Right. So this is exactly, if you can imagine, the implant is quote leaching and basically sending those toxins into the blood. You can only imagine what's spilling into the saline. And then when you rupture the saline, it spills all over, the body absorbs it, and that's, if you will, the perfect medium to send that saline tainted with silicone into the rest of the body. And we know, if I may summarize from the other Facebook Live that I did with Dr. Atul Mehta, where he is a pulmonologist out of the Cleveland Clinic out of Cleveland, who did a biopsy of the lung of one of the patients, and lo and behold, the pathology slides showed that there's silicon within the lung. And when I asked him, how do you think the silicon made it, and he said, of course, from the silicon from the saline implant going into the bloodstream and then making it into the lung. And this is where you have what is, if you put the two and two together, the way the silicone basically migrates and mobilizes itself to the rest of the body. And what you mentioned very importantly, how many patients have had palpable lymph nodes, biopsies done, and the next thing you know, you have giant cell reaction, foreign body reaction consistent with what is the silicone spilling into from what is a ruptured implant. And you mentioned this earlier, you could have an intact implant, just like the intact saline implant that Dr. Atul Mehta mentioned, and that intact saline implant could be sending those particles, those silica particles, to the rest of the body. And we know from that one generous patient from the Netherlands who donated her body after she passed away, God bless her soul, in the Netherlands, where they did a biopsy on the different tissues. She was noted to have ruptured implants, and they concluded that the silicone was in the different tissues at different densities all over her body. And this is consistent with what is the silicone toxicity.
And I just picture breast implants. Put them in the microwave or heat them up. They're not stable. So when I was out in 104-degree temperatures in Nevada, I was just, I was smelling it, I was kind of tasting it, and I just thought, these things are leaching into my body. And people would ask me, what is that smell? There's some kind of chemical going on. But it was definitely exacerbated at that time. And so, the fact, I don't have science that says that it does it or how it does it, but for me personally, I feel like it absolutely leaches into the body.
Absolutely. And this is, we have, so what the pathologist did out of the Cleveland Clinic, they actually sent the tissue off to a lab in Buffalo, New York. And what they did was electron microscopy. Electron microscopy. This is a paper that's published, by the way. And number two, this is on my private breast implant illness support book page, so we will bring it up so that it will serve as an announcement. So they did electron microscopy, and number two, they did what is called energy dispersive x-rays. And they concluded 100% you're wearing a black headgear, right? With that certainty, you're wearing this gray sweater and you're wearing the jeans. With that certainty, they saw what is, during those two studies, what is silicone embedded within, and this is how they made that assumption. Now, some people went out and said, well, she was drinking out of a bottle that had silica in it. Now, you know, and again, you can always say something, you know, but the bottom line is the pattern of silica that was present was the same as was present on the silicone. And this is where I say, hopefully, and this is what I mentioned to any of the biomedical engineers, biochemists, maybe we can get a blood test, spin it, and do energy dispersive x-rays and electron microscopy out of the lymph nodes and the axilla. And I propose to someone, whoever, maybe a undergraduate or a PhD student, if they can do this test, we can find out. Because this will be a nice, unique way to look at and see, because silicon is dense, it will gravitate down, you can centrifuge, and you can do this analysis, which we know from the many papers, this has been proven and shown. Another patient of mine, you know, and again, I see patients with chin silicone implants. Another patient I talked to from California had implants in her calf because she wanted to look robust and like muscular, and she now has the symptoms of BII. She does not have saline or silicone implants, but she has all the symptoms, and she's getting an MRI with and without so that we can see how much inflammation there is. Another patient and series of patients that I've seen that unfortunately went to another non-board certified plastic surgeon, lo and behold, they injected silicone industrial grade into the buttock area. She has had a CTA which shows all the silicone. Unfortunately, it's gravitating down and she has this foreign body reaction. And unfortunately, this is the same thing we're seeing, what is occurring around what is the chest. So we have data as doctors, as physicians, as clinicians. I, as a biochemist from my undergrad, this is of special interest, where, you know what, if there is a conclusive study, i.e. where we can show with electron microscopy and energy dispersive x-rays, we can certainly show it in the ladies, and hopefully we can do the test routinely in ladies, like that lady in Henry Ford, the young 35-year-old who had stroked out on the right side in the ICU for 6 weeks, and all the doctors refused to accept it was the implants. And unfortunately, this is where it is such a mysterious illness. It continues to evade the many doctors, the many subspecialists.
And unfortunately, most of us are seeing about a dozen specialists to take care of all the health concerns that we have now.
Right.
And another thing about finding the silicone in the blood and in the system, one of my GPs said, you know, I think that you're having some kind of heavy metal problem. So we had a heavy metals test. That was lead, cadmium, and arsenic.
Wow.
And I've since had another one, and I'm still full of heavy metals. I don't have cadmium in my system anymore, which to me, you know, I tried to detox. I think, you know, that was one that was a little lower concentration, but the lead hasn't changed. And as being somebody that had a child test for lead, and about the time I was in college, I was tested for lead as well. I never had a positive test for lead. And I'm like 4 times the highest amount that's supposed to be in the body.
Wow.
And so that to me says something's going through the system as well, you know,
Right,
as far
right.
as your blood goes.
No, very important point. If you look at the chemical composition of the implants, you will see like a whole list of 50 different platinum and all these other different heavy metals that are present. Now, one thing I want to mention and highlight, this is a topic in itself. Many patients ask me, what can I do to detox? And I'll say the best detox is your plastic surgeon removing the entirety of the capsule and implant and leaving no inflamed tissue behind, period. For someone to get the infrared sauna or to do vitamin C, I tell them, listen, just take an orange a day or a lemon, you're good. You don't need to take these supplements that half of which are made in China and God knows what and how they're making them. They're not regulated. You may have pure chalk in them, or you may have a very high level of vitamin C and you could get vitamin C toxicity. Or you don't have to take all these herbal medications, which I will tell you, you never know what's the ingredient. They have not been tested and tried, and they don't go through these battery of tests that the FDA does. They are unregulated, which is to my surprise. So I question the validity of these detoxifiers. Some patients said that you can take charcoal. Well, guess what? At the emergency room, the patient who ingests like 20 tablets of aspirin in order to kind of suicidal, they give that to those, or who accidentally ingest like a kid, they will give the charcoal, so the charcoal binds to the aspirin so that the body does not absorb. But like Dr. Atul Mehta said, the closest it can get to detoxifying is to do a plasmapheresis, just like a dialysis where they clean the blood. In this case, they clean the plasma so that the body is void minus what would be, so that again, you have a lower concentration of what would be the silicon toxicity that's floating around. Now, you mentioned very important the ICD-10 code, because this is where, and if I may start summarizing, write to your local representative, and this is all what you mentioned tonight. Write to your doctors, your rheumatologist, write at the local newspapers, write an article on the Nicole website, write an article on the many other websites, write your testimonials and how you bounced back. You know, one patient came today, this is the other lady from Brazil, she was so happy. She said, I feel like I'm crying in happiness that I have these toxins out. She had a path report. And I said, she now is going to write about her experience, because just like you can only imagine the dramatic turnaround. Here you were with implants, now without, and how you bounced back. And the bottom line here is, this is what's fueling and driving. This is that attachment that every woman has to the other sister who basically has this misery and is hurting. And at the back of everyone's mind, including mine, everyone asks, am I going to get better? Is it going to be worth it? And I say this to you, and I'll end with this. Number one, breast implants are not meant to be in the body forever. They have a limited time span. They have been banned once, and hopefully soon they will be banned again, and so that no more of this misery. We talked about your true presence here. An ounce of prevention is better than a pound of cure. Is that what they say in the English language?
Absolutely.
Yeah, and so this is the prevention, informed consent for the prospective patient who are going to get implants. Number three, the implants have been associated with lymphoma. Textured for sure, but guess what? The other smooth ones too. And quote me on this because it has been shown. Number four, the implants are below the pec muscle, and given the contracture, pain, the irregularities that they caused. One patient came to me last time, and this is another patient today I saw. She had the last mammogram done 13 years ago. She said, I don't want to go and do my mammogram, and the next year, it's going to rupture. Another lady yesterday, I wrote for, she's got a grade 4 contracture. I don't want her to get, because it's so painful to get a good mammogram. I wrote for an MRI for her. So what an MRI cannot be done, and a mammogram cannot be done because the patients are afraid because of the pressure mechanical effect. And plus the self-monthly breast exam, which is the number one reason why and how women pick up on breast cancer. Now, that in itself should be a reason not to augment, because this is the 1 out of 8 or 9 women who are going to get breast cancer, and we don't want to miss on the self-monthly breast exam or on the mammogram that will pick up. We know the implants are replete with contractures, up to 15-20% depending on the surgeon and how it was done. We know the implants are associated with rupture, pain, and certainly the rashes, and again, all the symptoms of BII. And imagine the implant is being put below the pectoralis muscle. Any movement of the arm will cause the pec muscle, so you find these ladies who are not able to truly lift, because every time they move, they have the implant move, they cause symastia, where it travels to the midline, or it causes the implant to move or bulge to the side. Another lady I was talking to from Ohio. And the point here is, this is the surgery where I have not met a single patient to date who has regretted removing implants. And number two, to date, I have not met a single patient who says, I wish I had never put in the implants, and they had wished they had removed the implants sooner, so that they would have gotten their life back. And I say, where in surgery, where in the world, where can you have a procedure where not a single patient has remorse about removing the implant, where we have a remorse about everything in life? You know, you get a watch, you get a car, you get a house, you get to go on vacation, you have a remorse. And so this is where I say there's so much ample evidence why the implants are not, quote, lack of a better word, worth it, and don't harm your body. It's not worth it.
Yeah, no, associated surgeries, you know, there's just so much trauma that you don't really realize until you look at a diagram of a breast implant going under the muscle, or, you know, when you really look at that, it's, you know, it's hard stuff on your body in the first place.
You mentioned something very important. A lot of surgeries. So someone who gets breast cancer, 63-year-old, another friend of mine from medical school, mom got breast cancer. She had to go get tissue expanders, replacements. She was not happy. There was a focal dehiscence, so she had to go get that debrided, washed out. Luckily, she was able to save. And the next thing you know, she got a contracture. They had to repair that. And then not only after that, she had to get the nipple areola reconstructed. And this is times where the patient has the tissue expander. The next thing you know, the final pathology comes back, and the patient has positive lymph nodes, and she has to get radiation now. And they radiate the chest, and you have a tissue expander underneath, and a major, quote, disaster waiting to happen. And I say, you know, I'm a big fan of DNT, do not touch. This is where, just like my neighbor with the transplant, I told her, DNT, do not touch. I love to operate, but don't do unnecessary surgery. That will only continue and may cause all the harm and ill that may haunt you for a long time. Please go ahead and say whatever you have to say. Hopefully we'll pass this around to the many other BI sites so that we can get similar legislation passed in the other states.
Yes, definitely use your voices. And again, I'll say it again, Michigan, contact your state representatives. Tell them that Julie Kelly is going to be bringing a bill to vote soon, and tell them your stories and how it's affected you and how much you want them to support this bill 100%. And just bug them again, bother them again. I just think that the more that we use our voice, it really does make a difference. I've done this with other passionate things that, you know, I feel a lot about, and really getting in there and raising your voice is the most important. We want a checklist. We need to know what that manufacturer book says about our life getting these breast implant medical devices.
Absolutely.
You know, and we need to know where to report our adverse effects. So, you know, use your voice, stand up, and, you know, be your own advocate as well, because like I say, I see about a dozen specialists, and, you know, half of them are well aware how much better I am after having my
And you alerted them.
Yes, and they bring in colleagues, they bring in students. This is Dawn. She's gotten remarkably better after removing her breast implants from breast reconstruction after cancer. So the more that you can do that too, I know a lot of you see a lot of different specialists, you know, talk to them, tell them, you know, hey, tell your colleagues about this, because there's so many women that are going in there and getting this deer in the headlights look. And, you know, you kind of sound crazy when you have 50 things wrong with you all at the same time, but it's not crazy. It's an inflammatory response. You know, we need to get our voices out there. Contact your reps. People in other states, contact your reps. We want this to go all the way. Eventually, we'll be contacting their congressmen, you know, and taking this to a federal level.
Absolutely. And you know what? You know, the U.S. has been the center of excellence for everything on earth, for the healthcare, the best healthcare. You know, we're setting the momentum for the world. We're setting the standard that we're going to bring about this change, not only to the women in the U.S., Canada, Mexico, South America, Europe, Middle East, everywhere, so that every single person who has implants will be able to better learn from what you mentioned, because today was a very important day. We summarized, we went over a lot of important hot topics, and we just want to raise awareness.
Yes.
We want to alert everyone, and we want to make this world a better place.
Yes, we want to keep people healthy.
Yes,
You know?
simple as that.
Yep, definitely. Make informed decisions. That's what it's all about. And thank you so much again for having me.
No, God bless you. I appreciate you. You know, I know you drove quite a distance, and I'm very excited that you were able to come and we were able to have this meeting. Thank you so much.
You're
All right,
welcome.
I'm going to go ahead and step up, and I'm going to stop the Facebook Live.